dentist here in Boise, Idaho at Maple Grove Dentistry, and I'd like to tell you about guided implant surgery. As we've talked before, implants are my favorite way to replace missing teeth. There's nothing closer to your actual tooth or your real tooth than with replacing it with an implant. Now when we go to place implants, it's critical that we place them exactly where we want them to go. The bone usually in these areas isn't real thick, and we have to watch out for critical structures like your maxillary sinus, a little hole above your teeth on the top, or your inferior alveolar nerve. That's a nerve that runs right down through your jawbone. So when we place implants, it's real important that we know where these structures are and that we avoid them so that we don't create any complications. So let me go ahead and show you how these guides work and how they can benefit you and make implant placement a much safer procedure for you. So this is a 3D model of a patient that we had printed. This is their mandible, or their lower jawbone. These are the teeth that are towards the front, and this is the tooth in the back. So you can see here where he's got a space where he's missing some teeth. So one of the things that we can notice in this model is kind of a white line that's going right down there through that mandible or through that jawbone. That white line is the inferior alveolar nerve. So that's real critical that we don't place an implant on top of that or next to it, because it can cause nerve damage, which would then cause us to lose feeling and sensation. So implant placement in this case is really critical that we get it exactly where we want, which is just a couple millimeters away from the nerve, but then that we stay within that bone. You can see where that's real thin, and so if we go too far, your tongue would be over here and you'd be out into that tongue space. So we need to get it exactly where we want it. So that's where these implant guides really come in handy, because what will happen is they'll snap down in place similar to a night guard or a sports guard, and you can see where there's some metal sleeves in there. So what those metal sleeves allow us to do is to place that implant exactly where we need it to go, exactly where we want it. The implant drill will then go down through that sleeve into the bone, and there's no wiggle room. It's not going to deviate one way or the other. It's going to go exactly where we want it. And we're then able to go back and put our implant in that same place after we've prepared the osteotomy and prepared that hole with the drill. Okay, so that's guided surgery. Again, they look like night guards. They fit down over the tops of your teeth, and they help us to place implants in a safer, more efficient manner. So if you or anybody you know is looking for implants, please give us a call at 208-853-2221, and we'd love to help you.